My name is Jessica Leung. I'm an epidemiologist at the Centers for Disease Control and Prevention. Today I'll talk about the article titled Chronic Medical Conditions as Risk Factors for Herpes Zoster. This article will appear in the October 2012 issue of Mayo Clinic Proceedings. First, I'd like to acknowledge my co-authors, Raphael Herpes, Ridwan Joseph, and Stephanie Bialek for their contributions to this study. Herpes zoster is commonly known as zoster or shingles. It's a painful skin rash that can lead to postherpetic neuralgia or PHN. Zoster is caused by the reactivation of varicella zoster virus in the cranial and dorsal root ganglia. Each year, approximately 1 million people in the U.S. develop zoster. The risk of zoster increases with age. Although people 60 years of age or older are more likely to develop zoster and have severe pain and PHN, half of all cases occur in people younger than 60 years old. Immunosuppressive conditions can also increase the risk of zoster. However, approximately 90% of cases occur in people with healthy immune systems. There's a lot we still don't know about what causes zoster and why the incidence appears to be increasing. Also, we don't know what distinguishes the large number of people who develop zoster from those who don't. In our study, we set out to identify factors that are widely prevalent in the U.S. that may be associated with zoster. Given the increasing prevalence of many chronic medical conditions, we reasoned that exploring this might fill these gaps in our understanding of risk factors for zoster. We conducted a case control study using healthcare claims data from 2007. We only included data for adults aged 20 to 64 years. We were concerned that associations between zoster and chronic conditions might be obscured in older adults who have a higher risk of zoster due to age alone. We selected 10 chronic conditions: allergic rhinitis, chronic obstructive pulmonary disease, coronary artery disease, depression, diabetes mellitus, gout, hyperlipidemia, hypertension, hypothyroidism, and osteoarthritis. All of the chronic conditions we investigated were more common in people with a history of zoster compared with those who didn't have a history of zoster. The odds ratios, adjusted for by sex and the number of outpatient claims, ranged from 1.06 for diabetes to 1.52 for depression. The risk of zoster was significant for each chronic condition except gout and hypertension. However, the attributable fraction for each condition was small, and the conditions do not appear to provide an explanation for the vast majority of zoster cases. Zoster is a common illness, yet the causes for most cases of herpes zoster remains unknown. Furthermore, it's not clear why the incidence of zoster appears to be increasing in the U.S. and elsewhere. Although some chronic conditions may increase your risk of zoster, these conditions are not likely to explain why most people develop the disease or why the incidence is increasing. New hypotheses and studies are needed to fill these knowledge gaps, which could help with developing more effective approaches for controlling zoster. In the meantime, zoster vaccine is effective at preventing the disease in older adults. Clinicians should be aware that zoster can affect all adults whether they have chronic conditions or not. They should offer zoster vaccine to all eligible patients who are 60 years of age or older.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.